Do you sometimes feel so angry that you scream, cry, or throw things when things don't go your way? Imagine a child who gets extremely upset every time they lose a game, like kicking the board, yelling at friends, or crying for over 30 minutes. While all kids get angry sometimes, kids with Disruptive Mood Dysregulation Disorder have this kind of intense anger almost every day, and it's hard for them to calm down. This constant rage isn't just bad behavior, it's a real mental health condition that starts in childhood. Does that sound familiar either for you or someone you know? It's important to understand that DMDD isn't about manipulation. It's about struggling to manage big emotions in a healthy way. So why does DMDD happen? Scientists believe it's a mix of biology, brain function, and life experiences, not just bad parenting or spoiled kids. Think of the brain like a car's engine. In kids with DMDD, the emotional gas pedal might be stuck. Their brain overreacts to small frustrations. For example, if most kids feel annoyed when they can't play video games, a child with DMDD might completely fall apart, like their whole world is crumbling. Genes may play a role. If a family has a history of depression or anxiety, the child might be more likely to develop DMDD. Also, early life stress, like family conflict, bullying, or trauma, can make it harder for a child to learn how to cope with emotions. But here's the good news. Knowing the causes helps us find better ways to help. Frequent, intense temper tantrums that seem too big for the situation, like shouting for 20 to 30 minutes because they can't have a snack. These outbursts happen at least 3 times a week and are seen in more than one place, say, at home, at school, or with friends. Between tantrums, the child often seems irritable or angry all the time, like walking around with a storm cloud over their head. For example, they might snap at a teacher for a small correction, or refuse to join group activities because everything is stupid. Unlike normal mood swings, these symptoms last for a year or more and make life hard at school, at home, and with friends. If this sounds like someone you care about, it's worth talking to a professional. DMDD isn't diagnosed with a blood test. It's based on interviews with the child, parents, and teachers. A mental health expert will ask, how often do the tantrums happen? How long do they last? Are they happening in different places? They must rule out other issues like ADHD, anxiety, or bipolar disorder, because treatment depends on the right label. Once diagnosed, the best treatment combines therapy and support. For example, a child might go to a weekly session called CBT, Cognitive Behavioral Therapy, where they learn how to spot anger early, like a red warning light, and use tools like deep breathing or talking it out before it explodes. Parents also learn how to respond calmly, set clear rules, and praise the child when they handle frustration well. In some cases, medicine for mood or focus can help, but it's always paired with therapy. The goal, not to stop the child from feeling angry, but to help them handle it better. Can DMDD be prevented? We can't change genes or erase past stress, but we can create environments that help kids manage emotions early on. Think of it like building emotional immunity. For example, teaching kids from a young age to name their feelings, "I see you're frustrated," helps them understand emotions instead of just acting on them. Simple routines, calm reactions from adults, and safe spaces to talk about feelings make a big difference. Parents can model healthy responses, like taking deep breaths instead of yelling when something goes wrong. Schools can use social-emotional learning programs where kids practice calming tools during class. If a child already shows frequent anger, early help, like talking to a counselor, can stop small problems from growing into bigger ones. Prevention isn't about perfection, it's about support. Scientists are making progress in understanding DMDD better. For years, kids with severe temper outbursts were misdiagnosed with bipolar disorder. But now we know DMDD is different and needs different care. Recent research uses brain scans to see how kids with DMDD react to frustration. One study showed their emotional centers light up more than usual when they lose a simple game. This helps develop better therapies. Another advance is online programs for families, like apps that help parents track moods or practice calming techniques together. Researchers are also looking at whether certain genes or early habits can predict DMDD, so help can start even earlier. The goal is personalized support, finding the right tools for each child. So, while DMDD is tough, science is moving fast to give kids and families real hope.